Welcome to Women's Health. Hi, I'm Jeanne Schumacher, co-founder of the Pregnancy Advantage, where we help women to get their bodies pregnant ready. Or if you're having trouble conceiving, we'll help you there too. My partner is Dr. Debra Shapiro, who is a board-certified OBGYN. And today's topic on women's health is something that is near and dear to my heart because, oh my gosh, I cannot even begin to tell you how many UTIs I've had and interstitial cystitis. I actually, before we start and jump into this, Doc, I actually went to a urologist who was a woman. She was an OBGYN and urologist, and her entire practice was made up of people like me who were having issues with UTIs and interstitial cystitis.
So urinary tract infection is an infection usually with bacteria, a certain number of bacteria that are causing an inflammatory response inside of the urinary tract. And most commonly, we're talking about lower urinary tract infections because the urinary tract is made up of the kidneys, the ureters, the bladder, and the urethra, right? So what we're usually talking about when we talk about an uncomplicated UTI, that means an infection inside that's contained within the bladder. But you can also have, if you let this go and you don't treat it, then the infection can ascend up to, through the ureters up to the kidneys and cause a kidney infection. And this is very serious because, all your blood gets filtered through the kidneys. And so then if you have a kidney infection, you can actually have septicemia and very, very serious. So we're particularly concerned about bladder infections when women are pregnant. And one of the reasons is because when you have a bladder infection, I'm going to now call them just bladder infections because that's what we're really talking about. When you have a bladder infection, you know it. You almost always know it. It causes this very specific kind of pain when you pee. There's a kind of stinging pain that happens at the end of your stream. I mean, I've had them enough to know when I remember what that was. It's like this griping, horrible pain of your urethra when you have a urinary tract infection. But what's interesting, and that drives you right to the emergency room or to the doctor or to the clinic right away to give a urine sample and have it grown for culture and be treated. But when you're pregnant, you actually can have a bladder infection without having those symptoms. It's very interesting. And I don't really know why evolutionarily that might be good because I don't think it is. But we often find, and we always check for bladder infections. We check urine, at every visit, but certainly at the beginning of your pregnancy, we check to make sure you don't have something that was just slipping by. And if you have any possibility of a kidney infection when you're pregnant, you actually have to be hospitalized on IV antibiotics. It's not something that we can just treat as an outpatient. So there are differences in the way we treat urinary tract infections in pregnancy and also when you're not pregnant. So let's go back to bladder infections. What is the cause of a bladder infection? Well, it actually is your own bacteria that is around the anus and the perineum, and that makes it usually up and gets pushed up into the urethra from the friction and just the process of sexual intercourse, or even with sexual toys too. So there's this just pushing the bacteria that are around the perineum up, which is that area between the vagina and the anus, and getting it pushed up into the urethra. And our urethras are very, very short, unlike a penis, which is much longer, up to the male bladder. They're less likely to get bladder infections, although they can. But in a woman, the urethra is very short, and so it doesn't take long for bacteria to climb up the urethra. And if there's urine, nice warm urine inside of the bladder, then it's a perfect medium for them to grow, and poof, before you know it, you can have sex one night and the next morning you wake up and you have a bladder infection. Where are these bacteria? What is the source of these bacteria? I said they were coming from your own gut, and that's true. But what's interesting is that quite often these bacteria can be traced back to some of our food, especially chicken. It turns out that 90% of the E. coli that turn up in bladder infections in women can be actually traced to chicken. And partly because of the way that the chickens are kept in these horrible conditions, crammed together, they're infected. They're given a lot of antibiotics. And so a lot of these bladder, and I've seen this as a physician, as an OBGYN, that when women have E. coli infections, and really infections with all kinds of bacteria, they're often resistant to multiple antibiotics. And that's not because you were taking lots of antibiotics. It's because the chicken was given lots of antibiotics. So how can you avoid E. coli infections that can be traced back to chicken? It's not just about eating the chicken, really, because if you go to a restaurant and you get chicken that's cooked, you don't have to handle it. the E. coli should not be there, but it's really more about you buying chicken in a store and coming home and dealing with it, washing it, handling it, cooking it, so it's interesting. I mean, Dr. Greger has some great videos about this, but they were looking at different studies where they told women, okay, you're going to have this chicken. Here's the chicken. We're going to give it to you. Now cook it. And they told women to clean everything very, very well. They still found E. coli everywhere in their kitchen. They even told them to use bleach and clean everything, and they still found it. So these bacteria are very hardy, and they are going to survive. So the best way, really, and of course, we're always promoting a whole plant food diet. You would not be eating chicken, so that's great. You wouldn't be handling it. You wouldn't be eating it. You wouldn't be cooking it. So that's very important. I want to give some other tips about how to prevent a bladder infection. And these have worked for me pretty much. I suffered from a lot of bladder infections, and it was this endless cycle of antibiotics and then yeast infections, and then it was horrendous. So what I learned to do, wash before. You want to reduce the load of bacteria that are around your anus and around your perineum. So wash your perineum before. I know it isn't that spontaneous, but it will just really help. If this is a problem for you, if it's not a problem, that's fine. Different women have a different amount of space between their anus and their vagina. And some people have a very long perineal body, very long, a big space between, and some people have a very short perineal body. So if you're someone who doesn't have much space, then it's much more likely to get bacteria that are pushed up. So wash before and pee before, because as I said, if you wait and you have intercourse and there's some urine in your bladder, then they're just going to start multiplying and having a party right away. So pee before, so there's no urine in your bladder to start with. And then get up right afterwards. You can't just fall asleep. You have to get up and pee again, because you want to be flushing out these bacteria. And then also drink a big glass of water at that time when you pee, so that within a very short period of time, like another hour or so, you're flushing those bacteria out again. Wash before, pee before, drink a glass of water, and pee after that as well. Okay, so that should hopefully really help. The other thing that's really fascinating about bacteria and urinary tract infections is that some bacteria that live in our gut that have been associated with bladder infections, called Proteus mirabilis, seems to be much more common when women have something called rheumatoid arthritis. And rheumatoid arthritis is an autoimmune condition where your body makes antibodies against a molecule in your joints. It's very painful, and it causes all kinds of disfiguring changes in your joints over time and can really be quite debilitating. So this is very, very serious. But what's very interesting is that it seems to be, in many, many cases, a case of something called molecular mimicry, where there is some part of this bacterium, in the Proteus mirabilis bacterium, that resembles what is in our joints, this joint molecule. And so the antibodies against this bacteria then go and attack the joint. So that could very well be one of the etiologies of rheumatoid arthritis. So how can you change that? Can you change your gut microbiome? Absolutely. Absolutely. If you go to eat more of a plant-based diet and stop eating meat, your gut bacteria changes entirely, really entirely. You have much more of the healthy bacteria, less of the bacteria that you don't want to have, bad species, and you can actually reduce the symptoms of rheumatoid arthritis. The joint pain is reduced very, very quickly when people switch to a plant-based diet. You can also increase your flax seeds, which is always a good thing to do. Have a tablespoon of flax every day. Not only does it give you the omega-3s, which is very important as an essential fatty acid that's anti-inflammatory, but it also helps to flush out extra estrogen from your body, reduces the risk of breast cancer, and it helps to get rid of some of these bad bacteria as well. So it'll help to change the fecal flora. So flax seeds and no chicken in a plant-based diet, and do all those other things we talked about. Wash before, pee after, drink more water, and pee again. That will be great. Something else that you can do actually to prevent the stickiness of the bacteria from, the bacteria are sticky and they're sticking to the bladder wall, is cranberry juice, or cranberry, I would get unsweetened always, or cranberry capsules. Because cranberry, actually, there's something in them that's not a way to treat a bladder infection, but it might be sort of a preventative, because it will help to keep, it makes the bacteria less sticky and less apt to stick to the walls. So eat a plant-based diet, avoid handling chicken at all costs, and eat your ground flax, and maybe try some cranberries, and do all those other things we talked about just around sex as well.
good to know those tips. Handy piece of information to have, because wow, and it started when I started going into menopause. Like I'd never had a urinary tract infection up to this point ever in my life, and then
Well,
I was having a lot of them.
right. And so partly we talked about just the way the distance between your perineal body and the distance between your anus and your vagina. But the other thing is just how healthy the tissue is around the urethra and around the vulva as well. Because when you're having intercourse, there can be micro tears, microscopic tears and irritation and more inflammation. And that's going to make it much more likely that bacteria is going to be able to ascend and to get up. And when you are menopausal and you've lost that very essential estrogen for the tissues, they get very, very thin, and you're much more likely to get a vaginitis and a bladder infection. So both.
And then the interstitial cystitis. What a special thing. I mean, you never know because the symptoms are all the same, in between a UTI and interstitial cystitis. So I never knew. I mean, the only way that I could ever tell was that urine test or blood work, to see if the
Yes.
infection was
Right, because one of the other symptoms of a bladder infection is that frequency, right? Having to go all the time. The frequency, the urgency, and the dysuria. That's the things we always talk about with a lower urinary tract infection would be frequency, having to go all the time, urgency, that feeling like you have to go, and then dysuria, that pain. And you can have the same symptoms with something called interstitial cystitis, which is just this chronic inflammation of the bladder, and it does need to be checked out to make sure you don't have an infection, which, as I said, would not really go away by itself, and if left untreated, could actually ascend to be a kidney infection and then go on to be septicemia, of infection in your blood, which is killer. So,
just so special. Can I just say
yeah,
sometimes?
tell me about your experience with interstitial cystitis. It's a terrible chronic condition.
Oh my God. And like I said, I went to this specialist. She was an OBGYN, a woman,
Yeah.
OBGYN and urologist at the same time. And all she got for me, I said, what is causing this? What? No. Really? I mean, you specialized in this and you can't give me any, okay, whatever.
No.
But it was not a particular, and that has since calmed down. It's pretty rare that I have it. And I think a lot of that time, because I was starting menopause, but I was also starting my plant-based journey too. So in transitioning, away from meat and chicken, we used to eat a lot of chicken, so I'm sure that was part of the problem too. But, now I don't have chicken. So, but I want to talk about, because I found this in the Journal of Biological Chemistry. And this study appears in the June 26th issue. And it shows that the acidity of urine, as well as the presence of small molecules, can influence how well the bacteria grows in the urinary tract. And first of all, let's just talk a little bit about pH, okay, and what means whether something is acid or base. And so we have the scale, a pH scale from 0 to 14. 7 is in the middle and it's neutral, okay? But I need you to understand that the pH scale, it stands for potential for hydrogen ion. It is a logarithmic scale. What does that mean? Debra, I'm so glad you asked. You're great. You're awesome. So what does that mean? It means like if you go from a factor of 7 to 6, it's not a factor of 1, it's a power of 10. So going from 7 to 5 is not a factor of 2 or 20, it's a power of 100. So 7 to 4 is 1,000, 7 to 3 is 10,000, 7 to 2 is 100,000. So, the lower the number, the more acidic something is. So these urine samples showed that the urine coming out, the acidity of the urine was one of the major factors in this. And so the urine samples that prevented bacterial growth supported more activity of this key protein, which the body naturally makes, in response to an infection. And then the samples that permitted, these infections, or samples that permitted the bacteria to grow easily. Past research has suggested that this helps the body fight infection by depriving the bacteria of iron. So that's a mineral necessary for bacterial growth. So the data led the researchers to ask if any of the characteristics of these volunteers were associated with the effectiveness of this protein. So it turned out that age or sex did not turn out to be major players. Of all the factors that they measured, the only one that really was different between these two groups was the pH, how acidic or how basic the urine was. So, yeah, I mean, in a plant-based diet, is pretty much, I mean, because there's a lot of controversy about this, and I talk a lot about, because our bloodstream has a pH of 7.35 to 7.4. It's that precise. So anything that you're consuming, especially like animal products, they're extraordinarily acidic. So your body has to alkalize that before it can get into the system. So you will do that, but at a cost to you biologically. For example, like if you're drinking a soda, okay, let's not even talk about animal products, but just like a soda or something like that. A soda, most sodas come in between a pH of 2 to 3. So that means you're drinking something that has a pH of 10,000 to 100,000 times more acidic than the body should be dealing with. So you're going to alkalize that. You have to, otherwise you're dead. That's what dying is the acidification of your body and the fact that you can't correct that. That's what dying is. And so when you start to think about it, your body has to be able to alkalize that, and you will, but at a cost biologically, because you're going to be taking minerals out of your skeleton, the calcium, right? You're going to be taking magnesium from your muscles, or sodium or potassium, but you will alkalize that, okay, for sure. So I thought that was absolutely fascinating that this study came out, and it just kind of reinforces that, because the majority of the things that we eat in a plant-based diet are extraordinarily alkalizing to the system. There's only a few things, that, especially things like proteins, like your beans, they're made up of amino acids. So, they're slightly acidic, but the majority of the food that you're eating is going to be very, very alkalizing to the system. So you're not going to be stressing your system out. So that is a great promotion for the plant-based lifestyle, because as you get closer to 7, right, that it is, I mean, the urine per se is actually just the metabolic waste that we're getting rid of in the body.
What's interesting is that Dr. Greger has this lovely pee test that you can do. So you take, have you heard of his cabbage pee test?
Heard about it. I mean, that's just, you're just getting an indicator.
Yes, an indicator, but it's really fun to do. So you can, and he has the color chart up on his website, but you take purple cabbage and you whirl it up in your Vitamix and you have it with water. So you pour that into your toilet bowl and then you pee on it. And then you see if your urine is more alkaline or more acidic. And so you can get it just the way you'd like it.
Right.
So
yes. If you are, if you can get your urine a little bit closer to the alkaline side, then the chances of having the urinary tract infections, so, the title of the article is "The Risk of Urinary Tract Infection in Vegetarians and Non-Vegetarians, a Prospective Study." So I thought that was absolutely fabulous.
The average urine sample is around 6. I mean, it really does, go through the range. And so we sort of want it in that more neutral range, I guess. We don't want it very low and we don't want it very, very high.
Okay. Well, we have a question from Brittany Giroudi, and she asks, what prenatal vitamins do you recommend? I'm turning that one over to you.
I don't know of a particular brand, so you're going to have to look. Some things might have to be taken separately also. So if you're plant-based, then you're going to need a reliable source of B12. And I do like Nature Made because it's USP certified. It comes in 1,000 micrograms, and you can take 2 of them. They melt in your mouth, so you're getting mixed with these transport proteins in your saliva, and it's very well absorbed, and it's cyanocobalamin USP certified. So that's what I would recommend for B12. It's 1,000 twice a week. It's 2,000 a week, and that's very easy. A prenatal vitamin needs to have 150 micrograms of iodine. It'd be great to have one with some choline because you do need about 450 milligrams of choline. You might need to take also your vitamin D because you need 2,000 of vegan D3 a day. And you might need to take your extra DHA or DHA/EPA 250 to 300 milligrams from an algae source. So that also might have to come separately. But your prenatal vitamins can be a mix of, they usually put a small amount of the different B vitamins, and they usually have the folate or the folic acid. And we talked about that earlier on our other show, that we really preconceptually want you to have 400 micrograms of extra folic acid, 600 when you're pregnant, 500 when you're breastfeeding. And the amount of iodine also goes up. So it's 150 preconceptually, 150 micrograms, 220 when you're pregnant, and 290 when you're breastfeeding. So in the book, becoming vegan, she talks about all the different amounts of nutrients that you need, both preconceptually when you're pregnant and when you're breastfeeding. And you can just sort of take a snapshot of that and then take it with you to the health food store and look and see, but you may not be able to get everything. There are other nutrients of concern like iron, and there's going to be some in your prenatal vitamins, but you might end up needing extra later if you develop an anemia of pregnancy when you are pregnant. Also calcium, you are not going to be able to get your whole day's calcium, 1,000 milligrams of calcium or close to it in a vitamin, because it's just too much. So that's something, if you can't get it through your diet, through calcium fortified foods like calcium fortified soy milk or calcium fortified orange juice or something. And of course the low oxalate greens and beans. But if you can't get close to 1,000, then that's something also you might want to take an extra 500 milligrams of a Tums 500 or something, or a calcium chew. So, and that's what we go over also in the Pregnancy Advantage, all these elements of concern. But I think I went through most of them, the ones that are super important preconceptually: the iodine, the omega-3s, the folate, especially choline, calcium, and B12. But you can't, sometimes you can't get it all in one little place. I mean, certainly what I told patients in the past was just get any prenatal vitamin, because I assumed that they would have the amount of folic acid that they needed, which they all do, and the iodine. But now I think if you look very closely, some of them don't actually have, and you might need to take a pinch of iodized salt, because 3/4 of a teaspoon of iodized salt will also give you the 150 micrograms of iodine that you need.
She goes on to ask, and I think this is the same Brittany that's going to be at the National Health Association conference. So, and if that's the case, Brittany, we'll see you there too. But she asked if Dr. Furman's prenatal vitamin would be a good choice, but then she followed up to say, can you have too much folate? Which is interesting because we just talked about that, the folate and folic acid. And so she says, can you have too much folate with my plant-based lifestyle? And this one prenatal, it was through the roof. So I switched to Dr. Furman, and which had much lower in that one. So
okay, in general, I think that Dr. Furman's vitamins are probably very, very good.
But I haven't seen the levels for the.
No, I don't know. Can you have too much folic acid? Yes. Can you have too much folate? I mean, methylfolate, it's possible too. I mean, there's an upper limit of normal, and I don't want you to have too much of something. It's all, especially an isolated vitamin or mineral or something. If you've listened to or read Dr. T. Colin Campbell's book Whole, it's, what goes on in our bodies is like this huge, incredibly complex symphony. And I think I've mentioned this in sort of analogy before. I mean, you need all the instruments to be in harmony and in balance, and suddenly you wouldn't want to have 20 tubas. You might like the sound of a tuba, but you don't need 20 tubas. And that's why when people say, oh, I'm taking extra zinc, I'm taking all this zinc, well, you don't want to do that, because that throws off something else. You can't you can't absorb copper. You can't manipulate one thing without it affecting everything. So
you might want to just go back, Brittany, to your blood work and see, and it sounds like you're doing that, like what you said, that it was through the roof already. So I'm assuming that it was through blood work, that you were doing that. So.
Oh, you mean your folate level in your blood was extremely high?
Yeah. She said with my plant-based lifestyle and this one prenatal that she was taking, it was through the roof. And then she switched to Dr. Furman's, which is much lower.
Right. So absolutely. What people are able to eat, I mean, now, and we live, and I'm probably talking to someone who's pretty much able to buy what they want and have what they want and have lots of greens and beans, and they have access to everything. And, this is a kind of discussion of accessibility and of, abundance. But there are certainly people in the world who don't live like that and who may be deficient in some of these nutrients. So when we try to tell people what to do, we're sort of trying to speak to everyone. And that's why it's good to have classes where we have smaller groups and we can talk about individual needs. So we're talking to you, you're someone who's very, very knowledgeable about what the nutrients are in your food, and you're trying to eat for health, and you're not trying to eat just because I want something to make me feel good. You want to feel good in a different kind of way, but not just that dopamine hit, but you're really interested in optimizing your nutrition. So that's a very different discussion than somebody who lives in a more impoverished part of the country or impoverished part of the world who really doesn't have access to greens and may not know really how to cook beans or any of that. So that's so when we talk to you, I think you just have to look at what you're eating. And I think, I don't know, you missed it this morning, but if you look back, I did read from Brenda Davis's book where she says, if you are eating an optimal plant-based diet with lots of high folate-rich foods, you may not need to take extra folic acid. But to be clear, just to reiterate what I said this morning, was that the studies that showed a reduction in neural tube defects like spina bifida, failure of the brain and spinal cord to fuse and form properly in the embryo, were done with folic acid. And that's why the U.S. Preventive Services Task Force and ACOG and really March of Dimes and everyone else says that preconceptually you should be on 400 micrograms of extra folic acid as well as a nice folate-rich diet. And when you're pregnant, you should have 600 micrograms, and when you're breastfeeding, 500 micrograms. So that's why I can't really tell you that you don't need folic acid. But I know that there are certainly groups that feel like folate is fine and methylfolate is fine. I did read in one, I'm not sure exactly how great this source was, but I did read about side effects from too much folate. So I don't want you to get too much, just enough. There is an upper limit of normal, and that's, I believe 1 milligram. Sometimes you have to take more though, if you have a child, if you've had a child with a neural tube defect, or if you're on certain medications that can cause the P450 system in the liver to degrade it too quickly. So if you're on anti-epileptic medications, then you might need more.
Well, Brittany just commented, she said that they're talking about growing your family soon. And so that is what our whole program is about, is to make sure that your body is pregnant ready, because it's so important, to make sure that your body is as healthy as it possibly can before conception. So I just have to say, that's the whole point of our program. Not only to get the food right, you have to change 3 things. I call it the trifecta. What goes in, so food and drink. You have to change what goes on. So that's personal care products, the environmental toxins you're being exposed to, and then you have to exercise. Can't get around that one. Got to exercise. So those are the 3 major points. We talk about a lot more in our program, but wow. Anyway, Debra, we need to wrap it up. We have next week, we're going to be talking about breast cancer. Gosh, wow. One of the big ones. And so many women are being impacted by that. So we hope to see you. We're going to be next Thursday at 2:30 in the afternoon. So I look forward to seeing you then, Debra. Always a pleasure connecting. And thank you so much, Brittany, for joining us on our conversation. And
yes, good conversation. And if anyone's interested in looking at testing your diet with the pea and purple cabbage, it's on nutritionfacts.org. It's testing your diet with pea and purple cabbage. It's really fun.
I'm sorry. You can do that. I'm going to take pH strips. They have a narrow range for testing your urine, okay? I'll just pee in a little cup and I'll dip my little stick in, call it a day. So you can pee with the cabbage. I'm going for the stick. So.
I think if you had kids, it would be fun to check your kids' pee. I think they able to see the different colors and what they eat and how they can change the pH of their pee.
Yeah, because you're just dealing with an indicator and it's changing in response to pH. So.
Oh, you're just a chemistry teacher.
I know.
Nothing's funny to you anymore.
No, sorry. Because I do that all the time. So anyway.
All right.
Debra,
thank you.
I'll see
Bye,
you
everyone. See you next week. Bye-bye.